Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. We have two guests. I always love whenever we have two guests on. Jonathan, Bonnie, great to have you on the podcast here today.
Nice to be
Thank
here.
you.
Thanks.
Good to be here.
What I would love is, well, this is just how it's set up on my screen. We have Jonathan, then Bonnie. So we'll start with Jonathan. Quick intro for you. Jonathan, tell us a little bit about your background, then over to Bonnie, and then an overview of HDI. I know our audience would love to hear that. And then we'll go into our chat here today.
Okay, so Bonnie will do the overview of HDR. She does a much better job of it than I do. I've been involved in healthcare data for 30 plus years, embarrassing to say. Started out doing payment system development for Blue Cross Blue Shield plans, moved on to employer reporting for self-insured employers, and founded a company called HDMS in about 1995. And that was sold to Active Health, which was sold to Aetna in 2007. And I took some time after that, serving out a non-compete actually. And in 2010, started Health Data Innovations. I will tell you more about exactly what it does. Go ahead, Bonnie.
Yeah, and I'm Bonnie Cassidy. I'm the Chief Operating Officer at HDI, Health Data Innovations, and I really oversee all of our sales and account management function, along with some operational data operations impact. My personal background is in healthcare payment system design, healthcare policy, and data and analytics for reporting. And like Jonathan, I have a little bit of time spent with self-insured employers and helping people make employee benefits decisions. I joined HDI about 2 years into its growth, really to help us grow from our original founding client into what we are today. And so HDI was started to help healthcare. Really, we started with a single client, a large Blues plan that needed help getting data from external sources into their system, into their data warehouse to support care management, group reporting, actuarial, whatever, anything that they needed, any of their data-driven decision making. And what they were finding is they were actually losing money because they couldn't get new groups, new employer groups that were coming on up and running fast enough to start doing the kind of medical management, care management, member outreach that they needed to do. So they turned to Jonathan and said, knew him from the previous company and said, can you help us get data onboarded faster? Jonathan was lucky enough to bring on some of his staff from HDMS who had helped build that kind of data stack at HDMS and Active Health. And they started from scratch and said, if we were going to do data integration, not just because we needed it into our own tool, but as a service that we could offer to anyone. So we're kind of agnostic to the data coming in and agnostic to the form that it comes out. And what we're really expert at is making and we focus mostly on claims data. And by claims, I mean that kind of broadly, any of the kind of administrative data, eligibility and attribution, medical and RX claims, and all the other associated data sets that go along with it. But really to create a common framework for understanding that data so that the dollars are the same regardless of what the data source is, so that you can count utilization, cost, and member information regardless whether it comes from Humana or Cigna or Blue Cross or Aetna or CMS.
Oh, and Jared, the reason for the business is really, the fragmented nature of the healthcare system manifests itself in the data fragmentation as well. And most of these organizations who are our clients, whether they be providers or payers, are reasonably good at managing their own data, but they really struggle when they need to ingest data from other sources. And because of the fragmented nature, there are hundreds, if not thousands, of other sources. So the chore and the difficulty of bringing in somebody else's data to use in your own system is a significant one for most of those entities. So we take that pain away from them.
Let's stay on that for a second, Jonathan, too. So I know, and thank you, Bonnie, for the breakdown as well before. I would love to continue to dig deep into why ingesting claims data is really the key for success as it relates to value-based care. Maybe we go with Jonathan and then we kick it back over to Bonnie just to kind of continue with that, but would love to talk a little bit more about that. I
In
know,
the
Bonnie,
context
you
of
shared a
value-based
little
care.
bit already.
So the obvious thing in the value-based care world is the providers use their EMR as the core source of clinical and medical information. The piece that they're missing, especially in the value-based care contracts, is the claims data, and often as it relates to out-of-network utilization. If you have a value-based care contract in a local area and your members seek care out of that network, it's not going to exist in your EMR. The only place that really it exists in is at the payers database in the claims data set. So when we take that data in for many of our provider clients, it supplements their clinical data, the EMR data, so they can get a more complete longitudinal picture of patient care. And the financials that are in the claims data are much more associated and closely aligned with the financials that the payers manage and pay these risk contracts and risk contract bonuses. Those are the two main areas.
And the only thing I would add to that is that the providers, when they enter into these risk-based contracts under the kind of value-based care framework, they're being told by the payer, you're responsible for this 10,000 people, right? And so they need to have the full picture of those people, but they also need to make sure that they are in alignment with what the payer says in terms of who the attributed population is and the details of the care that those people are receiving inside and outside of their network, cost and utilization. And if they don't get the raw claims and they don't effectively integrate them, then they're just kind of trusting that the person who set the contract is reporting the right dollars and the right members to them. So it really is kind of a fiduciary responsibility to track and manage their contracts, even if they didn't do anything with it from a care management perspective, but they all do.
Bonnie, staying with you for a second, then we'll kick it back up to Jonathan. Can you both like discuss the key steps that provider organizations need to take, I guess, just to even make their claims data effective in the first place?
Yeah, I mean, the very first thing they need to do is standardize it in a way that they can apply kind of the same analytics across all of their different payer contracts, right? So CMS's Medicare Shared Savings format is very, very different than how Aetna presents the data. So in order for them to effectively use any of this data, they need to make sure they're capturing it all on a monthly basis. They've got to deal with all the different layout formats that it comes in, which by the way are changing very regularly. I don't want to say every month, but every month some payer has tweaked their layout in some way. And they've got to be able to understand the intricacies of how each payer has represented the paid claim information, denials, reversals, adjustments in the data to get down to what really happened and what was really paid for it. So just starting there, really before they even make any use of it, they've got to make some sense out of it.
Yeah, and it's consistency is the key issue because most of these providers have multiple contracts with multiple payers. There is no standard uniform way of dealing with the key analytic attributes within these databases, specifically, reversals, denials, adjustments, multiple claims for a single admission. All of those things are dealt with differently by the different payers. And in order to do real-time analytics, you want to do analytics independent of the source. You want to say, how many readmissions do we have in 30 days? And not say, well, we have to do that differently for each of the 10 different payers. So the idea of standardizing that on the front end to allow for an analytically ready and consistent database is the key challenge.
Let's go back a little ways now to I know we've talked about some success. We've kind of given an overview. Let's talk more about HDI some more. This is a question I love to ask guests lately that come on, and it can go to either of you, whichever of you wants to take it. Uh, what's something you wish people knew about HDI, customers, key stakeholders that maybe they don't know?
Well, the truth is, all of our clients know everything we want them to know about HDI. They know we deliver, we're on time, we're on budget. We're obsessive about detail. We really deliver. What we'd love to know is how more people who are not our clients know about that. That's kind of my take. Barney,
Yeah, I would agree with that. I guess the one thing I wish that clients would know is that although we make it look easy, it's still hard, right? And so clients who've tried to integrate claims data themselves, they understand how hard it is and how many opportunities they are to do it wrong. But we have a 15-year track record and have built out some pretty incredible tools that we use to make it look easy, but it's still hard.
yeah.
And so I wish they just kind of not take for granted. They through experience have seen that we make it really easy for them. We hand them data that's ready to use. Sometimes I wish they knew how hard it is in the background.
We were joking a little bit before we started recording, right, about this type of stuff, and I always think back to I'm a huge tennis fan, played a lot growing up, still play. And I always look at Roger Federer and how easy he always just made it look. It was effortless, right? And then you try to go and play even at a small percentage of that level, and it's nearly impossible. the best companies truly do find that sweet spot, right, of making it look so easy. So I think that's just kudos to you and your team for being able to do that. And I think if your customers and any outsiders even thought about it more and took a maybe even deeper look at it, they'd realize that it is very difficult, and there's a reason why you can make it look so easy because you've spent the time, you've built the right setup. So kudos to you and your team.
And we
Thank
have a
you.
lot of repeat customers who are not necessarily from the same company, but people who move from entity to entity who immediately call us. They're the ones who really understand it, and those are our prized contacts within our customer world. They know as soon as they get to a new job, the first call they make is to us. Those are the
I
ones
like
who
that 'cause
value the most. Yeah,
those might be, I mean, I don't wanna make you say favorites, right? But those must be some of your favorite type of, customers to land when someone moves on somewhere and they love working with you so much that they wanna bring you into the fold into their new organization.
exactly. And they go into these organizations and they're charged with doing this work, and they say, "You know how hard this is?" And people say, "We think we do," and they say, "No, you don't. Call these guys." And those are our favorite because it's an easier sell for us because we come in strong.
We've
Love it.
also had we have a long-term relationship with Epic, and I think that's my other favorite client, that Epic will refer somebody to us and say, if you need to do this to get into our tools, you need to get this data into your system, you should call HDI. And sometimes they'll be like, you'll get into the contracting process and somebody in the contracting department will be like, well, do you have any references? And I always am like, other than Epic? You need a bigger reference than that. And so we do love to work with people that have understood that this is difficult. And especially, like when you're working with people who maybe are already working with clinical data, and clinical data is hard to work with. We don't really touch it very much. It's hard to work with because it's voluminous, right? And it's every day. There's just a constant spooling of data. But it's easier in that my blood pressure today doesn't change what my blood pressure was yesterday. Whereas within a claims data set, new information can come in that will actually adjust a claim, or you can change historical eligibility. And so you have to be able to deal with things that happened in the past. So you always are looking back and comparing things to all history in order to transform and process a new data set. So I think people who come in and think they understand healthcare data because they've worked with clinical data, claims data is just another kind of mind numbing twist on that data. So we do appreciate our friends who have either tried to do it or have looked at it and are like, not for me.
And the other thing, Jared, is it's not really been a core competence, a requirement for a core competence within these organizations until lately. So people say, okay, we got IT guys, we got tech guys, we can have them do it. And it's completely not suited to their training and expertise. So a lot of the success we have is when IT tries to take this on, and it is not an IT initiative. It shouldn't be, and they fail because they just don't know how the stuff works. So most of the providers, most of those organizations, just do not have that skill set resident in the companies now to do this. They really need to hire in or contract out. It's tough with the internal resources.
Interesting. Staying with you, Jonathan, for a second, and then we can kick it back over to Bonnie. What's next for HDI that you can share with our audience here today?
We were talking about this. Is really, for now, it's more of the same, right? We just want to reach more and more people because there's so many more entities who are at risk, who are struggling with us, who do not know about us. We need to get to them and help them and really essentially expand our presence within that world. We continue to enhance product and improve efficiency and find new things, but the basic mission is the same. So there's no brand new initiatives that are going to redirect what we do. We're just going to continue marching forward, doing what we're doing in a slightly quicker, more broad-based way.
And all I would add to that is that what we're finding is that as the provider organizations, health systems, hospitals, whatever, are continuing to look at best of breed technologies, they don't want to have to reintegrate their data every time, right? So they're looking to HDI to say, okay, we loaded our data into Epic and now we want to send it to Arcadia, or now we want to use the Tuva model, or can you spin it over to Milliman? And so what we're finding is we have a lot of clients where we're now taking the data in one time and sending it in multiple directions. And what they're finding is that they don't have to revalidate. I mean, you always have to validate the result in an application, but they're not having to revalidate how the other vendor integrated the data because we've already done it once and we can send it in multiple directions. And all of those organizations that I mentioned have their own capability to do claims data integration to get data into their system. The question is, can they do it at the speed and the scale that HDI can do it at? And so we have very positive partnerships because, again, anybody who's tried to do this and knows how hard it is appreciative of our expertise. So I think that's a little wrinkle in what we're seeing going forward, just more people wanting to own their data, if you will, and have the freedom to send it wherever they want.
That's becoming more important as these point solutions are showing up, these entities that focus on one specific condition or disease. And there are a lot of them showing up and they need the data too. So the idea when an entity sends it out to multiple ones of these, it's the same data. So there's no reconciliation issues. That's becoming, we're seeing more and more of that now.
I like it. I really enjoyed the conversation with both of you here today. Look forward to future chats, hopefully, and please keep us up to date on any new news. I know our audience would love to hear it, and I especially would love to hear it. Thanks so much.
Thanks,
Thank you.
Jared.